Hello, DOGTV. Joe Myers here, back with another DOGTV chats. These chats have been bringing entertainment and excitement, but today we're focusing on education. There has been a lot of noise and information about dogs and COVID-19. Questions, concerns, comments, worries about my own dog, about dogs in general, and we feel the best way to start that conversation is to talk with an expert who's on the ground, this has been his life's work, and working with animals and human-animal bond, and a veterinarian. And so he's going to tell us a little bit about what's going on, and we want your questions. We want to answer what's going on in your world, get as many questions answered as possible, so you can sort of breathe easy as a pet parent. So please welcome my guest today, David Haworth, PhD, DVM, DOGTV veterinarian, president of Vidium Animal Health. Welcome, David.
Thanks, Joe. Great to be here.
Thank you so much for joining us. You're in Arizona. You're nice and safe and warm. How's it going today?
I think everything is going great. The golden retriever down by my feet's telling me things are okay. He's already gotten his walk in for the day.
Oh, I love it.
Awesome. But it's a scary time. It's a scary time for everybody. So this is scary stuff, and the idea that our pets could be in danger, or our pets could even be worse, endangering ourselves, is something that I think we all want to take really seriously. I can tell you from the outset that that's just not the case. All the evidence that we have points to our fellow humans being a much bigger risk to us than our pets. But we can get into the details of that as we go through this.
Awesome. Can we start with your background a little bit, sort of your history, and then what you're currently doing in the animal space?
Yeah, absolutely. You bet. So I'm a veterinarian by training. I also have a PhD in physiology. I did a postdoctoral fellowship as well. I was in practice for a little while, and then I spent about 11 years at Pfizer Animal Health, which is now transferred to Zoetis Animal Health. And while I was there, I was in both research and development. I was also in business development, but I led our vaccine development team for a while for companion animals. So we actually developed a coronavirus vaccine. Corona is not a new set of viruses. And so we've been doing this for a little while. We know a lot about coronaviruses in general. Not this one. This one's new. This one's only about 6 months into its lifespan in the world, but we do know a bit about it. I spent another decade in nonprofits working both with Morris Animal Foundation, which is a large funder of veterinary research to benefit pets particularly, and then also a little while as the head of PetSmart Charities here in Phoenix. And now we've got a little startup genomic diagnostic company for pets that's trying to bring some of the tools we have for human medicine into the realm for pets.
Excellent. So, very, very well versed to answer these questions and to give us some advice. So if you have any questions for David, add them down below. And we'll try to get to as many as possible. So let's start off with the big topic, the big elephant in the room, Winston the pug. Can you sort of break down what happened, what occurred, and sort of what's happening right now?
Sure, absolutely. So Winston the pug. What happened was two doctors, an emergency room doctor and an infectious disease doctor at Duke Medical Center, contracted COVID-19. One of their children contracted COVID-19. They all had clinical signs. And then afterwards, they participated in a clinical trial doing serial sampling on themselves and their other family members. Mm-hmm. During that trial, one of the doctors realized that their pug was having some difficulty breathing, doing some snorting and sniffling, doing some coughing. Now, any of you who know pugs know that that's not an infrequent occurrence with pugs under the best of circumstances. And it is also, just to point out, allergy season in North Carolina. But regardless, they tested Winston, and he did come up positive as of yesterday. They hadn't confirmed that at the National Veterinary Services Laboratory, but we can guess that he definitely was with COVID-19 or had the SARS-CoV-2 virus in his nasal passages.
Okay.
So this might be a good time to talk about the concept of fomites or carriers and infections. So I don't want to make this is a complicated concept. So if there are any questions, I'm happy to go further into it. But essentially a fomite is anything that can carry a virus or a bacteria, an infectious agent. It might be a couch pillow. It might be a plate. It might be a doorknob. It may be a dog.
Yep.
Now, if I was to take, even if you and I were practicing great social distancing, and I was infected with COVID-19, and I had a football, and I sneezed on the football, and then I threw it 20 feet to you, and you caught it, and then you wiped your nose, you would be getting that. So you'd be being exposed to that virus. That's pretty simple for us all to think. It looks like pets can serve that same purpose. So if I sneeze on Winston and he comes over and plays with you, he can serve as that intermediary between us, even though we may be 6 feet apart.
Yeah.
So we've seen now 2 dogs in Hong Kong test positive, 1 cat, a tiger at the Bronx Zoo, a couple of the other big cats at that same Bronx Zoo, 2 cats in New York, and 1 dog, Winston, now in North Carolina. There was also a questionable case in Belgium that we've seen that tested positive. To all of those cases of companion animals who tested positive for the SARS-CoV-2 all lived with an active patient who, as we know, spewing virus everywhere.
Yep.
So not unexpected at all that those animals may have been testing positive. Whether or not they got clinical signs, there's some evidence that cats can get clinical signs from this same virus. Also some evidence that cats and perhaps ferrets may be able to replicate that virus inside them, but they're not nearly as good at it as humans are.
Okay.
So humans and maybe some monkey species, but we don't even know that very well, can replicate that virus. The virus likes what we're able to do for it.
Yep.
It may be possible for the virus to replicate inside cats. No evidence at all that it's possible to replicate inside dogs. And so the point of all that is they're not going to be great transmitters. So in other words, the virus is getting into them, may or may not be causing some clinical signs, but then it's going away because it doesn't live well inside.
Okay.
As opposed to another human where the virus goes in, replicates, magnifies and amplifies, and then can be passed on.
Gotcha. So Winston could have passed it on to another human that came over, but very unlikely. He had it as a carrier, and then he got the clinical signs because it was but it wasn't replicated within his system. Is that sort of the standing as it's understood today?
As we know right now, yeah, that's right. And listen, there's also another study that was done by IDEX, which is one of the really big reference laboratories, and it looked at 4,000 samples that had come to it for animals with respiratory disease in the US, in Canada, in Europe, and in South Korea, and they found no positives.
Okay.
So the idea that there's a lot of dogs out there that are spewing out SARS-CoV-2, it just isn't the case. And dogs still don't seem to be any kind of real risk to us.
Gotcha. We're more of a risk to them potentially than us to them.
Probably so. Although, as a big proponent of the human-animal bond, I would say that social isolation is about the best time for us to be around our pets.
100%. And they've been certainly good. And is Winston the pug? I've heard from what I've read that he is on the path of recovery from the clinical signs of COVID.
I mean, Joe, he's a pug, so he's probably going to be snorking all his life. I mean, that's just sort of that territory. But yeah, from all accounts, it was a very mild. If he was showing clinical signs due to the virus, it was very mild and transient. And from what we can tell and don't forget, he's got 2 pet parents who are physicians, so they're probably pretty good at seeing these kind of things.
Certainly, yeah, they understanding the signs as well as anybody would. So we do have a question from the audience. So dogs haven't passed away yet from COVID. That's sort of like from SARS-CoV-2. That's sort of like heard.
Well, one of the two dogs in Hong Kong was a 17-year-old Pomeranian who had multiple underlying health problems. And so maybe worth saying that in Hong Kong, as you probably know, as probably everybody in the audience knows, Hong Kong had a much stricter lockdown. And so when there was anybody who had COVID-19, they were moved from their homes into isolation dormitories, essentially, that were under medical staff supervision. Their pets were also moved into quarantine. And so the two dogs, a younger middle-aged German Shepherd, if I remember correctly, as well as a 17-year-old Pomeranian, both went into quarantine. The Pomeranian did pass away 3 days after being released. There is no evidence that it passed away from COVID-19. It more than likely one of these underlying health issues and the stress of being quarantined and then unquarantined was probably a lot more to do with it. But sure, you're correct, but just probably worth being specific about the one dog so that nobody gets confused.
Definitely. Thank you so much. How is the medical community, the veterinarian community sort of handling this situation as new information is coming in? Dogs are going to veterinarians all the time. Sort of how is the protocol changed from a veterinarian perspective?
Well, that's a great question, and I think the answer is we're doing the best that we can. I tend to be a part of a lot of those conversations, not in leading positions, but just really interested in how our profession is doing.
Yep.
And mainly because I love this profession. The answer is they have to think about three different groups. They have to think about the pets themselves, they have to think about their staff, and then they have to think about protecting their customers and the clients that come to them. Mm-hmm. Most veterinarians are doing drop-offs and then have put off elective procedures as best as they can. I think that's probably smart. Being in a small exam room with a person, the biggest issue about human-to-human transfer is that some large percentage, and we still don't know how large, some large percentage of people who are actively spewing out virus don't have any clinical signs, at least immediately or sometimes ever. And so as a result, it's really hard for people to know, is this person safe to be close to? And that's why social distancing makes such an important step for us to do to try to break this chain of transmission and the exponential growth of viral cases so that we don't overwhelm the health system.
Yep.
Veterinarians are doing what they can do, but at the same time still trying to provide essential services to pets. And I fall into the camp of believing that veterinary services are essential services. These are parts of our family, and they need care. So
very much. Yeah, agreed. I think so as well. So that's good insight into that. We do have a couple more questions from the audience. I think these are important to gather. If you walk into a forest, could we leave the virus on plants, trees, rocks, and could the wildlife or dogs pick it up and potentially get sick?
Yeah, and so this is a great question to let you talk about the idea of risk analysis or living with a certain proportion of risks. Mm-hmm. Could that happen? Theoretically, it's possible.
Yep. In
practice, it's not. A human with a very large viral load, which probably means they're exhibiting clinical signs and don't feel like going for a walk in the woods, would have to be actively sneezing, putting all their sputum out into the world onto something that then could be picked up. Mm. There are very few other animal species that this particular coronavirus, this SARS-CoV-2, that can actually have it replicate inside their cells. In fact, there's probably none under normal conditions. There was one study that was done in China that experimentally under laboratory conditions introduced it to a number of species, cats, dogs, ferrets, ducks, geese, and found that only in cats and then not as well, and in ferrets maybe. Again, early studies, small numbers of animals, but also under experimental conditions. So kind of ideal situation for the virus, least ideal for the animal.
Yep.
Point is, if you're walking in the woods, cover your mask if you're feeling ill. Cover your face with a mask if you're feeling ill. Use those CDC guidelines. Wash your hands well when you get back. the chances of you passing it on to another species or another animal, almost non-existent. One of the problems in science is we can never say nothing could ever happen, but chances are pretty poor.
Yeah, I think that's the balance we're facing now between like scientific fact and actual reality. I think they're sort of fighting now a little bit.
Well, and unfortunately, the people who are most informed about this have to be honest about it, to say, yeah, there's a theoretical chance. Mm-hmm. There's a theoretical chance that an asteroid might hit the Earth today. Sure. It's really not something I'm going to plan on or worry about. And so in this case, and I'm not trying to be flippant at all, this is a disease that's fairly serious, but I also think we need to take practical matters into our hands. And walking a dog in the woods is probably one of the safest things that we can do. You can even walk them on the street. Just if you don't let your kids interact with other kids that they don't know, don't let your dog interact with other dogs that you don't know and don't feel very safe, is that they've been practicing social distancing too.
Certainly. Another question we have, what did China do to their dogs during their COVID problem, their active COVID problem? Was there anything special like they did in South Korea, or was it just anything you've heard of that matter?
So sure, always difficult sometimes to get the true story because China, of course, their state-run media will tell you what they want you to know. Mm-hmm. There are I shouldn't say lots of. There are anecdotal reports of pets that were abandoned inside homes during the forced isolation, because not unlike what I just described for Hong Kong, in China, they took the approach that you're not allowed to be home if you've got signs or any reasonable chance of having the virus. So you went off to fever clinics and then into isolation clinics. There are anecdotal reports that some of those dogs, some of the pets of those people, didn't have other places to go. This lets me make the comment that for all of us, we should have some backup plans on how our pets are being taken care of in case we get ill. Mm-hmm. Whether that's getting ill with COVID-19 or getting ill with something else that means you're going to be in the hospital for a while. Definitely. But in China, there wasn't anything draconian that they did. There certainly isn't any evidence that they took people's pets away or anything like that. For the most part, the pets kind of went through it, and just like our pets are pleasantly surprised that they've got human company, so much human company for a while.
Definitely. So sort of like they left, the dogs might have been abandoned for a brief while, and then but nothing else beyond that. So thank you, Christine, for that question. How are you and your dog sort of dealing right now with being extra time spent together? I know you're around your dogs a lot, but how are you sort of handling this extra time together? What are you doing to keep you guys, your human animal bond up?
Well, well, there are forced snuggles 3 times a day. We do have to do that. That's just, but I'm not sure we were doing that. We weren't doing that before. Joe, I think compared to most people, I'm in one of those places that's very enviable. I've got no one in my immediate family is of high risk. My kids are doing great. My wife and I actually like each other a lot. We live in a very nice home that we're happy in, and we live in Phoenix, Arizona, which is not a bad place to be in March, April, and May. There are a lot of people who are in much worse situations. And in those cases, I would just put a plug in that the human-animal bond has never been more important. One of those things that pets remind us is that we've got schedules. If you don't mind the schedule of the dog, they'll make you know for it. So you need to make sure we get into a routine. Mm-hmm. I think it's important for people to realize that dogs in particular are exceptionally empathic. And they pick up on our stress. And that doesn't mean you should suppress your stress. It just means don't be surprised if your pet is a little bit more anxious, because we have disrupted their world pretty significantly over the last 4 months. And so how are we doing it? We do a lot of walks. We keep our face covered. We make sure we maintain appropriate social distancing. And again, Snuggles, occasionally he likes to get into the swimming pool, but that's only because it's starting to get hot here.
Fair. Last question from the audience from Gwen. What information or supply should we prepare for in my human got sick and is gone for a friend caring for our pets?
Oh, yeah. Great question, Gwen. Thank you for that. Normal we say 2 weeks. So whether that means you just look at your bag and make sure you know you've got 2 weeks of dog food there, or you actually, I know a lot of people who have a go bag that just says that they take Ziploc bags, put their dog food, if it's dry kibble, into those bags, hold it there, they know, and then they have a rotating, so it's really easy. Other than that, you'll want their leash, you want their bowls, probably want shampoo, because if you are going to be taking care of someone's pet who has or is suspected to have COVID-19, it's important that that dog gets groomed. And I don't mean a professional grooming. I mean, wash the dog when you get home, just as you would if you were taking a package from somebody that you didn't know and you were bringing it into your home. Hopefully after you do that, you wipe things down, you wash your hands. There's no reason whatsoever to think that anything more than a shampoo would suffice for to make sure that that dog is clean. And other than that, any medications or particular treats or any training regimens that is normally part of that dog's routine, I'd have all that into a pretty easy package, because if you are really sick and you are about to get admitted to the hospital, the last thing that you want to do is run around have to put that stuff together. That's true.
Yeah. So if you understand that, get that stuff ready. Not overly ready, but get that ready and go from there. Awesome.
2 weeks.
2 weeks.
2 weeks back.
2 weeks.
2 weeks.
I love it. 2 weeks. Do you have any final thoughts for the audience? There's a lot of information, a lot of articles, a lot of people talking about this issue. What are your sort of like final thoughts to give pet parents some information and potentially some hope for the future?
Sure. Well, I mean, I think first of all, it's important for all of us to acknowledge that this is scary. This is the time that everybody wishes they had paid more attention in biology class. But we're learning also every minute. And I think there's the reason that you should have hope is because we have a history, and we as a culture, as a society, we're moving things forward, and every day we're learning more. We're getting more testing capabilities stood up. We're learning more about antibody testing and how can we monitor those people who have been infected and are now almost definitely immune. Mm-hmm. And what about those people who haven't been infected and maybe are more vulnerable? So learning that, taking care of ourselves first, taking care of our family second, which includes our pets, and then taking care of our larger community third, in that order. That's super important. And then, I think the lastly, remember that the owners, it's humans that we have to worry about here. This is a virus which is uniquely adapted to humans, not our pets. Our pets may carry it. And as we keep testing, we're going to continue to find more pets that test positive for this. Mm-hmm. But there's no evidence that this is a rampant disease in our pets, or that our pets are at any point helping in that transmission pattern. If anything, they're probably a fomite. So, keep yourself taken care of. And then I guess the last thing I would say is we're going to get through this. Society will be changed in some ways that are not as good, but also it will be changed in some ways that are exceptionally good. I like to think that one of the ways that it's exceptionally good is that we're taking more appreciation for the pets that we have in our homes, and we're taking a lot more strength from those relationships. And I think the human-animal bond has probably never had a better 6 weeks. Unfortunately, it had to come at the expense of a whole lot of illness and some unfortunate deaths.
Definitely.
But stay strong. Stay strong for yourself. Stay strong for your family. Stay healthy. Make good choices. Listen to the experts, because they really are experts. And we'll get through this together.
We certainly will. Well, thank you so much. If people want to learn more about the work you're doing or yourself, where can they find more information about you and the work you do?
Well, I think probably don't believe anything you see on the internet about me. I'm just kidding. Probably LinkedIn is probably a better place. I'm always happy to connect with people who are interested in this stuff.
Excellent. Well, thank you so much. Stay safe. Stay cool in Arizona. I know the temperature is rising there. All the best to you and yours. For our audience, I hope you join us back tomorrow. We're going to switch a little bit into a musical guest. I don't know if David sings, but we didn't have him test that ability today. But Buddy Mercury, he's a piano-playing dog, and his pet parents will be on tomorrow for a little DOGTV concert. So join us back tomorrow, 1 o'clock Eastern, here on Facebook. Have a wonderful day, everybody. Stay safe. Talk soon, guys.
Thanks, Joe. Thanks, everybody. Have a good day. Be safe.